Many of you have contacted us with your questions about the coronavirus, including what are COVID toes and how do you properly wear a mask? WBZ's Dr. Mallika Marshall joins me now with some of the answers. Doctor, we're going to start with Anthony's question. He posted this on Facebook and he asked, how come nobody seems to be dying from anything else?
Well, you know, that's actually a really big concern because, of course, people are dying from other things. And I think a lot of people are really afraid to go to a hospital or an emergency room right now. But heart attacks and strokes and other life-threatening conditions aren't on pause just because we're in the throes of a pandemic. So if you develop any significant symptoms, severe belly pain, shortness of breath, chest pain, new neurological symptoms, call your doctor or call 911 so you can get into the ER before it's too late.
All right, and this one also comes from Facebook. Roberta asks, why is it that the microphone shared by the speakers at press conferences is never disinfected between speakers?
You know, that's a good question, but if they're not touching the microphone between speakers, it's probably fine. If they do, then they need to wash their hands or disinfect after they're done speaking.
Okay, Dr. Jared asks, what are COVID toes?
So COVID toes are not on the list of typical coronavirus symptoms, but dermatologists, including those at the Brigham, are seeing more and more calls about concerns about itchy or painful red or purple spots on people's toes. It tends to happen more in younger patients, those with more milder symptoms of coronavirus. It tends to be harmless. They usually go away on their own, but some doctors are saying, look, if a patient presents just with these COVID toes, this rash on their toes, they should be tested for the coronavirus.
A necessary visual, but kind of a tough one. Dr. Bonnie on Facebook is asking, could you have Dr. Mallika demonstrate the correct way to wear a mask? Most people shown wearing them on the news are not using them properly. All right, doctor, set us all straight here.
Okay, I don't know if this is going to work on live TV, but you definitely want to cover your nose and your mouth. This is not okay. This is not okay. You want to cover your nose, pinch it if you can, if you have some metal there, and keep your mouth and your nose covered. Do not touch your mask until you can safely remove it.
I can't tell you how many people are going to appreciate that demonstration because I've taken a number of tweets and emails in the last week, and now you have shown us the correct way. Doctor, as always, thank you very much. If you have a question about the coronavirus for Dr. Mallika Marshall, there are 3 ways you can reach her. Her email, drmallika@cbs.com, on Twitter, @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.